Hi, my name is Jessica Wunsch. I'm a registered nurse, mother of two boys, a wife, a runner, a marathoner, and a longtime back pain sufferer. For the last 7 years, I've lived with chronic lower back pain. While there wasn't a specific instance or event or injury per se, it was something that started with a dull ache and eventually progressed into something that made my life pretty miserable. Well, probably the better question is, how doesn't it affect your life? For me, back pain affected everything in my life. I had to reduce my exercise. I had to make a lot of accommodations for daily activities. For instance, I couldn't sit at a desk and do work. My husband set up a workstation for me next to my bed so that I could type sitting in my bed. It made me grumpy. It made me tired. It made me feel old. In fact, at one point, I made a promise to myself that I would no longer discuss my pain. I wouldn't say, oh, my back is killing me. I wouldn't utter any words about my back pain because I was so sick of thinking about it, of talking about it, about verbalizing it. And I knew if I was sick of hearing myself talk about it, that everyone around me must be too. It didn't lessen my pain. It really just made my frustration greater. However, I knew that I needed to do something. This pain wasn't going away, and I knew I didn't want surgery. I tried lots of treatments. In fact, I'm pretty sure I tried every prudent treatment imaginable, from chiropractic care, physical therapy, cortisone injection therapy, rest, exercise, medications, acupuncture. Really, none of these helped for very long. The pain always returned, and the last bout of pain that I had kind of made me feel like I was running out of options. I felt lost. What was I going to do next? And in a way, I could tell that my doctor was getting very frustrated with me as well. After all, he's a surgeon, and I kept telling him I didn't want surgery. So after I debated what I was going to do next, I decided to switch doctors. And my new doctor said he thought I'd be an excellent candidate for stem cell injection therapy. So after he did some diagnostic tests, we set up the appointment. And I was thrilled, very excited, and couldn't wait to do this. My stem cell injection treatment was done in my doctor's office. It took approximately 2 hours. 1 hour of that was actually rest time. Part of the protocol for stem cell treatment is to have the patient lie flat for an hour following the procedure so that the cells can do their magic and adhere to the injured area. So yeah, the whole thing took approximately 2 hours. I was awake for the whole thing. However, the doctors can give you like an anti-anxiety medication. And of course, they numb the area where they aspirate the bone marrow. For me, my doctor aspirated the bone marrow from my posterior iliac crest, which means the back of my hip bone right here. I have a tiny little dot still there. They do use a mallet to hammer a large needle into your hip bone. And honestly, that's what I was most terrified of. Had me quite freaked out thinking about it. But I am pleased to tell you that that did not hurt at all. It's akin to having dental work. They numb your bone so much that you don't feel it. It's like pressure. Like when you're having dental work done, you can feel pressure, you can hear sounds, you know something's happening, but it's not painful per se. I had 7 injections in my back. I had 3 cc's of this bone marrow concentrate that's full of stem cells injected into my L5-S1 disc. And then I had injections at the L3 to L4, the L4 to L5, and the L5 to S1 facet joints bilaterally. Those are areas that I've always had treated in the past, so we did talk about it, and both my doctor and I decided that we wanted to treat the whole package to yield the best results. So honestly, the procedure was really not a big deal. As soon as I had the procedure, my doctor had me rest in the room for an hour, lying flat on my back, so that the cells could adhere to the injured area and do their magic. So then after that, I went home and basically did the exact same thing. I rested for the first 24 hours, which was all I felt like doing. I do think that there was a substantial increase in pain than I was expecting for the post-procedure. By the time I got home, 4 or 5 hours after the procedure, I was in significant pain. My doctor explained to me that this could happen because the stem cells start an inflammatory response, and that swelling causes additional pain. That's another good thing to mention, is that you aren't allowed to take anti-inflammatories. And obviously, after just saying what I just did, that makes sense. You want to allow the cells to do what they're supposed to do. So taking an anti-inflammatory medication could work against that. So you just need to take whatever medication your doctor prescribes for pain and use that accordingly. But I had my procedure done on a Wednesday and returned to work on Monday. So for the first 3 days, I really did need to take pain medication around the clock to mitigate the pain. For the next 2 weeks, I was still, sore, recouping back to baseline. However, each and every day I started noticing gains after the 2-week mark. And by 4 weeks, wow, I felt like a new woman. I felt like I had a new back.